In this video, we'll look at the liver and, specifically, how to reverse fatty liver. This is practical guidance, why the liver matters, how fatty change develops, and the steps that help the organ heal over time. Basic liver facts. The liver is a large organ on the right side of the body and weighs roughly 3.5 pounds in an average adult. It performs hundreds of tasks: digestion, immune regulation, detoxifying chemicals, manufacturing proteins, and processing nutrients. The liver is organized into many thousands of tiny working units that carry out this workload. It's possible for the liver to lose a large portion of its function before classic symptoms appear. In other words, feeling okay does not always mean the liver is healthy. That makes lifestyle and screening especially important. Common signs of advanced liver trouble. When liver dysfunction becomes severe, common signs include abdominal bloating, pain or discomfort in the right shoulder area, yellowing of the whites of the eyes, jaundice, skin problems and itching, particularly on palms and soles, and a rounded, protruding belly. These signs usually reflect long-standing or advanced damage rather than early disease. Liver injury usually progresses through stages. Inflammation. This can arise from infections, alcohol, medications, or poor diet. Repeated insults create ongoing inflammation and cell stress. Many common drugs and excessive alcohol use add stress to liver cells. Fat accumulation, fatty liver. Fat builds up inside liver cells when processing and storage become imbalanced. Over time, fat can replace healthy tissue. This is commonly linked with excess abdominal weight, poor diet, and insulin resistance. Fatty change is often detectable on imaging, such as ultrasound. Fibrosis and cirrhosis. Continued inflammation and fat deposition lead to scar formation. Scar tissue, fibrosis, disrupts normal liver architecture and function. Advanced scarring is called cirrhosis. At this stage, the liver becomes stiff and loses the ability to regenerate properly. Why liver damage can be missed. Blood tests and symptoms do not always reveal chronic liver disease. In some cases, only imaging or a biopsy identifies the extent of damage. That's why risk factors and lifestyle patterns are critical clues. Heavy drinking, frequent use of certain medications, obesity, and metabolic problems increase the likelihood of unseen liver injury. Effects of liver enlargement on other organs. An enlarged liver can press on nearby structures, including the heart. This mechanical pressure may contribute to irregular heartbeats, increased pulse rate, or higher blood pressure in susceptible individuals. Some people with an enlarged liver notice breathing discomfort or poor sleep when lying on one side. Sleeping positions that reduce abdominal compression can sometimes ease symptoms. Regeneration. The liver can heal, but it takes time. The liver is one of the few organs that can regenerate. Healthy liver tissue can grow back, but regeneration is a slow process and depends on removing ongoing damage and providing the right nutritional environment. Recovery can span many months and, in some cases, several years. That is why short-term fixes rarely produce lasting repair. Patience and consistent lifestyle change are required. Stop doing the things that cause damage. Before starting any recovery plan, the first step is to stop or reduce the activities that cause liver injury. Alcohol is a leading contributor to liver inflammation and fat accumulation. Many commonly used drugs, including some pain and cholesterol medications, can stress the liver when used repeatedly or in high doses. Reducing or avoiding these factors gives the liver a chance to begin repair. Remove harmful foods. Add healing foods. The basic strategy to clear fat from the liver is straightforward. Remove what harms the liver and add foods and habits that support regeneration. Bitter vegetables, an effective foundation. Bitter leafy greens and cruciferous vegetables are especially useful. Examples include collard greens, mustard greens, kale, spinach, radish, cabbage, and Brussels sprouts. These vegetables support liver detoxification pathways, supply B vitamins and other micronutrients, and help mobilize stored fat. Regular daily intake, through salads, cooked greens, or blended shakes, is recommended. Avoid deep-fried and processed fats. Deep-fried foods and hydrogenated oils place extra strain on the liver. These fats promote inflammation and make metabolic recovery harder. Replace them with fats that are easier to process. Prefer medium-chain triglycerides, MCTs. Medium-chain fats are metabolized differently and tend to stress the liver less. Coconut oil is a primary example. It works well for cooking and provides a source of energy that is gentle on the liver. Butter, in reasonable amounts and from high-quality sources, also contains medium-chain fats. Avoid cheap vegetable oils high in omega-6, such as many corn or industrial seed oils, and avoid hydrogenated oils. Apple cider vinegar. A mild daily practice that can support liver fat loss is to add a small amount of apple cider vinegar to water. For example, a teaspoon in a glass of water, and drink it a few times per day. This can help with fat mobilization and blood sugar regulation when used as part of a larger dietary pattern. Focus on B vitamins and choline. B vitamins, including riboflavin, B2, folate, and choline, play crucial roles in liver metabolism and regeneration. Vegetables, leafy greens, legumes, eggs, and certain whole foods provide these nutrients. Ensuring adequate intake supports the liver's ability to rebuild healthy tissue. Healthy beverage alternatives. If alcohol is used as a way to relax, consider substitutes that provide a similar ritual without the liver stress. Kombucha tea or other low-sugar fermented beverages can offer a relaxing, mildly effervescent option, while also delivering beneficial microbes. Cruciferous blends and concentrated support. A practical approach for people who struggle to eat large quantities of vegetables is to use concentrated blends of cruciferous foods. Blends that combine garlic, turmeric, radish, Brussels sprouts, kale, cabbage, and parsley can deliver concentrated nutrients and phytochemicals that support liver pathways. Parsley is especially nutrient-dense and pairs well with milder greens like kale in shakes or smoothies. Kale shakes and easy daily habits. A daily green shake containing kale, a small amount of fruit, and a source of healthy fat, coconut oil, avocado, can be a convenient way to raise vegetable intake. For many people, a single daily shake makes a measurable difference over weeks and months. Supplements as a practical option. For those who cannot consume large amounts of vegetables, targeted supplements can be helpful. Look for products that supply choline, B vitamins, and concentrated cruciferous extracts. Supplements should complement, not replace, whole food intake. Reversing fatty liver is feasible, but it requires an aggressive and sustained approach. Stop or greatly reduce alcohol and damaging foods, eat liver-friendly vegetables and fats, stabilize blood sugar, and supply key nutrients consistently. Expect the process to take months to years. Short-term attempts are unlikely to deliver lasting results. Increases bitter and cruciferous vegetables, replaces harmful oils with MCTs and butter in moderation, supports digestion with small daily habits, like diluted apple cider vinegar, and ensures intake of B vitamins and choline. Add fermented foods and consider a daily kale shake for convenience. If supplements are needed, choose well-designed formulations that provide core liver nutrients. Consistent change, patience, and avoidance of repeated insults allow the liver to rebuild itself over time. Start with clear steps and stay the course. Recovery is possible with the right habits. Thanks for watching. Please subscribe for more videos.